What are multiple choice questions, MCQs? In NCLEX, multiple choice questions are the foundation. You will read a clinical scenario or nursing-related situation and then choose the best answer from several options. These questions test your knowledge, critical thinking, and decision-making skills. Example question 1. A 70-year-old patient with hypertension is prescribed a new medication. Which of the following signs indicates the medication is causing a side effect that requires immediate nursing intervention? A. Mild headache. B. Dizziness upon standing. C. Occasional dry mouth. D. Slight fatigue after exercise. E. Persistent cough. Explanation. A. Mild headache, often a minor side effect, not usually urgent. B. Dizziness upon standing. This is orthostatic hypotension, a serious side effect that can cause falls and injury requiring immediate attention. C. Occasional dry mouth, common and manageable side effect. D. Slight fatigue after exercise, expected in some patients, monitor but not urgent. E. Persistent cough. Could be a side effect of ACE inhibitors and warrants evaluation, but usually not immediately dangerous unless severe. Best answer? B. Dizziness upon standing, because it poses immediate fall risk and requires prompt action. Great. Let's move on to screen 2. Select all that apply. Thinking like a nursing. What are SATA questions? These questions ask you to select all options that apply to the clinical scenario. They test your ability to identify multiple correct interventions, symptoms, or considerations, just like real nursing, where rarely only one action or factor matters. Why SATA can be tricky. Sometimes options may seem partially correct or closely related. Your job is to carefully weigh each choice and decide if it truly fits the question's context. This tests deeper understanding and prioritization skills. Example question 2. A nurse is caring for a patient with congestive heart failure CHF. Which of the following interventions should the nurse include? Select all that apply. A. Monitor daily weight. B. Encourage sodium restriction. C. Promote bed rest all day. D. Elevate the head of the bed. E. Administer prescribed diuretics. F. Encourage high fluid intake. G. Monitor oxygen saturation. Explanation. A. Monitor daily weight. Correct. Sudden weight gain can indicate fluid retention. B. Encourage sodium restriction. Correct. Sodium increases fluid retention and worsens CHF. C. Promote bed rest all day. Incorrect. Prolonged immobility can cause complications like blood clots. Activity should be balanced. D. Elevate the head of the bed. Correct. Helps reduce shortness of breath. E. Administer prescribed diuretics. Correct. Removes excess fluid. F. Encourage high fluid intake. Incorrect. Fluids are often restricted to prevent overload. G. Monitor oxygen saturation. Correct. Hypoxia may occur with worsening CHF. Let's move on to screen 3. Hotspot questions. Sharpen your visual and critical thinking skills. What are hotspot questions? Hotspot questions show you an image or diagram, and you need to click or identify the correct area related to the clinical scenario. These assess your ability to visually recognize anatomy, injury sites, or clinical landmarks. Example question 3. You are shown a diagram of the chest, anterior view. Identify the correct location to auscultate the mitral valve. Options, clickable areas. A. Second intercostal space, right sternal border. Fifth intercostal space, left midclavicular line. C. Fourth intercostal space, left sternal border. D. Third intercostal space, left sternal border. E. Fifth intercostal space, right midclavicular line. B. Fifth intercostal space, left midclavicular line is the correct spot. This is the apex of the heart where the mitral valve is best auscultated. The other options correspond to auscultation sites for other valves or are incorrect locations.
Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX RN. I know how stressful it can be, especially when you're balancing everything, clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX RN questions and answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and most importantly, help you feel more ready. Good luck. You've got this.
Perfect. Let's dive into Screen 4 Bowtie questions, tackling complex clinical scenarios. What are bowtie questions? Bowtie questions present a clinical situation where you must select 2 immediate nursing actions to take, 2 potential outcomes, positive or negative, and 2 parameters to monitor closely. They simulate real-life nursing where multiple simultaneous decisions and observations are needed. Why bowtie questions are important? These questions test your critical thinking under pressure, prioritization skills, and comprehensive patient monitoring, all essential in nursing practice. Example question 4. A patient is admitted with suspected acute asthma exacerbation. Choose 2 priority nursing actions, 2 possible outcomes, and 2 parameters to monitor. Options. Nursing actions. A. Administer nebulized bronchodilator. B. Encourage deep breathing exercises. C. Initiate IV corticosteroids. D. Prepare for immediate intubation. E. Encourage bed rest without movement. Possible outcomes. F. Improved airway patency. G. Respiratory failure. H. Pulmonary embolism. I. Decreased oxygen saturation. Parameters to monitor. J. Respiratory rate. K. Blood glucose. L. Oxygen saturation. M. Blood pressure. Detailed explanation. Nursing actions. A. Administer nebulized bronchodilator is critical to open the airways rapidly. C. Initiate IV corticosteroids helps reduce inflammation and prevent further bronchospasm. B. Deep breathing exercises may be helpful but are not priority during acute attack. D. Prepare for intubation is for severe respiratory distress but may not be immediately needed. E. Bed rest without movement can worsen secretions and is not ideal. Possible outcomes. F. Improved airway patency is the goal of treatment. G. Respiratory failure is a serious risk if exacerbation worsens. H. Pulmonary embolism unrelated here. I. Decreased oxygen saturation indicates worsening respiratory status. Parameters to monitor. J. Respiratory rate indicates breathing effort and distress. L. Oxygen saturation shows oxygenation status and response to treatment. K. Blood glucose and M. Blood pressure are less directly related here.